right now we have a death every 33 seconds in America from COVID. That is how bad this is right now. And what it means is what the White House task force told us in their last report. If you go anywhere inside with other people, especially if you're over 65 or have heart, lung, and kidney disease, you must be wearing a mask. You should be wearing a mask. It's now not just to prevent the spread of it, but there's so much disease out there that you are at risk. And there's so much disease out there that if you're not wearing a mask and you are in an indoor space or you're close to somebody outdoors, you are threatening their lives. If you are talking to any of our senior citizens without a mask, you are threatening their lives. So wear the mask. There was one piece in this Washington Post, and Kentucky doesn't always make national publications with something this positive. And that's that we're actually seeing some better results in the last couple weeks. And that is in hospitalizations. That's in our number of ICU beds. And we'll show you the regional map in a minute. And here's the Washington Post saying we're the only state in the country that's seeing some positive news, at least in terms of slowing the growth in the entire country. So to every Kentuckian who sacrificed in this last round of restrictions, to every Kentuckian who is wearing a mask every day, to every Kentuckian who is following the rules, look at that. I hope that makes you proud because that's your work. That's not my work. I may have to make tough calls. That's your work, and you ought to be really proud of it. Let's show you some other work you ought to be proud of, and that's our stair-stepper chart, which we now know by heart. And look at this. So we saw this very dangerous escalation, but we now have 2 straight weeks of decreasing cases. This is good news. We think it's probably stabilizing before it decreases any further. Today's numbers are a little over last week, but again suggests that hopefully we have plateaued, and then we hope to continue to see an increase. Though I don't think this next week will look as much of an increase as we had from this last week to the week before. Still, with the rest of the country on fire, this is good news. Still too many cases, still too many people going to the hospital, still too much death, but good news in that our efforts are absolutely making a difference. We also see that in the positivity rate. Now, this last week, the positivity rate increased just a little, and you'll see today's rate is a little bit below last week's average. We believe that we've seen some real stabilization on the positivity rate, which, as you remember, on some days had exceeded 10. And now we have down in the 8.5 range. We'd like to see that continue to decrease, but this number shows us that what we're seeing in our cases is real. And this is one of those leading and not lagging indicators. Some other positive news we see in our hospital capacity. In the last couple of weeks, we have shown you up to 4 regions in the red. We're now down to 2. And what that means is two regions that had their ICU capacity, I believe it was ICU, over 80%, have now gone under it. And in fact, region 4 is right at 80%. Again, you look at all this, and it's not all good news. The inpatient numbers are higher than we would like them to be. But from where we have been a couple weeks ago, where capacity is, and also getting vaccines out there, it shows that if we are really diligent in wearing masks and doing the right things, that we can care for those who get sick as we distribute these vaccines further. So today's report, we're reporting 1,988 new cases of COVID-19. Again, this is a little bit more than last week, which we'd like to see it the same or under, but it is certainly in the neighborhood. And it brings our total number of cases to 244,297 since the beginning of this. Current Kentuckians hospitalized is down to 1,580. Positivity rate down to 8.64%. Kentuckians in the ICU, 411. Currently on a ventilator, 231. We did have 15 new deaths today. Remember, 15 new deaths that we are reporting today. Remember, deaths lag the increase in cases by 2 to 3 weeks. That brings our total number of Kentuckians lost to 2,412. Far too many families that we have lost, and they need our help. So let's make sure we ring those bells every morning at 10 a.m. I just got a Christmas card of someone whose church has rang them every day of this pandemic at 10 a.m. It was special, and I want to thank her for sending that. Let's also continue to light our homes up green. That's the color of compassion. We've got a wreath outside this Capitol that lights up green every night in honor of those we've lost. And a Capitol dome that's safe for a couple days has been green since March the 6th. New cases by county: Jefferson 376, Fayette 97. Northern Kentucky continues to get hit hard. Kenton with 92, Boone with 80, Campbell had 60. Pulaski County, been near the top every day, 74 new cases. Warren County, 72. McCreary, 69. Shelby, 54. Graves, 42. Letcher, 42. Madison, 37. Clay County, 31. Knox, 29. Rowan, 28. Boyd, Christian, and McCracken, all 25. You can find the rest on kycovid19.ky.gov. All right. Remember that these individuals that we lose are more than ages and counties and genders, but that's how we recognize them during this time each day. And so these represent 15 individuals that should still be with us and 15 families who are going to be grieving and need our help. Today's loss include an 87-year-old man from Bullock County, a 75-year-old woman from Caldwell County, a 74-year-old man from Caldwell County, a 72-year-old woman from Clark County, a 68-year-old man from Fayette County, an 83-year-old woman from Hopkins County, an 82-year-old woman from Jefferson County, a 61-year-old woman from Johnson County, a 76-year-old woman from Livingston, and a 92-year-old woman from Livingston County, 88-year-old woman from Eulenburg, 92-year-old woman from Ohio County. Lost 2 individuals from Owsley County, an 87-year-old woman and an 88-year-old man. And finally, a 61-year-old woman from Webster County.